Okay, let's dive right into this. Welcome to this explainer, where we're going to unpack the incredibly dynamic and honestly often misunderstood world of breast health. For a lot of people, finding a lump or feeling a sudden sharp pain triggers instant anxiety. It's totally understandable. But today, we're going to systematically break down exactly how the medical field views, investigates, and treats breast conditions, moving us way past that initial fear factor. We'll explore the underlying anatomy, decode the brilliant diagnostic tools doctors use, and look at a modern paradigm that actually proves most breast issues are really just minor, temporary variations of totally normal bodily functions.
Here's our quick roadmap for today. We'll start with the anatomy of the breast, move on to the triple assessment, discuss the A&D concept, tackle managing breast pain, and wrap up with common benign breast lumps. Let's get started.
Section 1, Anatomy of the Breast. This is the absolute foundation of everything we'll talk about. The true, functional core of the breast is something called the TDLU, or the terminal ductal lobular unit. Basically, this is where the magic happens, but it's also where most problems tend to begin. The TDLU is highly sensitive to hormones circulating in the body, like estrogen, progesterone, and prolactin. What's super fascinating from a clinical perspective is how this specific tissue is distributed. Get this, about 50% of this highly reactive ductal lobular tissue is packed right into the upper outer quadrant of the breast. That is exactly why doctors pay such close, methodical attention to that specific area during a physical examination. Statistically speaking, it's where most diseases actually arise. So the crucial point here is understanding how the body filters fluid from this region. It's like a complex plumbing system, which brings us to the lymphatics. A whopping 85% of the lymph fluid from the breast drains directly into the axillary nodes. Those are the ones located up in your armpit. Surgeons actually categorize these nodes into levels I, II, and III based on where they sit relative to your chest muscles. Meanwhile, the inner half of the breast drains into the internal mammary nodes, which sit right behind the rib cage. Understanding these drainage pathways is absolutely vital, because if a cancer does develop, this is the exact highway it's most likely to travel down.
Moving on to Section 2, the triple assessment. Think of this as high-level medical detective work.
This three-step system is the absolute gold standard in breast diagnostics right now. Step 1 is clinical. That means taking a really detailed patient history and doing a thorough physical exam. Step 2 is imaging, using ultrasound or mammography to literally see beneath the skin. And step 3 is pathology, where a tiny bit of tissue is actually sampled, usually through a core biopsy. When you stack these three pillars together, the diagnostic accuracy approaches a staggering 99.9%. I mean, it leaves virtually zero room for error.
During that first step, the clinical exam, the actual technique used is so important. The examiner uses the flat pads of 3 fingers, never just the fingertips. They meticulously map out the breast tissue using what's called the dial of a clock method. Basically, they methodically press and palpate every single hour around the nipple to ensure absolutely no tissue is missed. It's incredibly thorough.
Then, when we move to step 2, imaging, the contrast between different types of lumps becomes incredibly obvious. Take a benign, simple cyst, for example. On an ultrasound, it's going to look perfectly smooth, completely round and dark, or what doctors call anechoic because the sound waves just pass right through the fluid. But contrast that with a suspicious solid mass. That's going to look highly irregular. It often appears taller than it is wide, and the margins around it are jagged and indistinct. This stark visual difference is exactly what radiologists are constantly hunting for.
To make sure everyone is on the same page regarding what they see on those images, radiologists use a universal language called the BIRDS classification. The scale ranges from Category 0, which just means the imaging is incomplete, all the way to Category 6, which means there's already a known malignancy. If an image scores a 1 or a 2, you are looking at a perfectly benign finding with essentially a 0% chance of cancer. Big sigh of relief. But if an image scores a 4 or a 5, maybe showing those jagged, irregular margins we just talked about, the probability jumps significantly. And that immediately tells the doctor, okay, it's time to move straight to step 3 and perform a biopsy.
Section 3. The A&D concept. This is a total paradigm shift in how we view breast health.
Now, what's really interesting about this concept is how incredibly reassuring it is. Notice how the medical terminology has completely evolved. Back in the day, doctors used some pretty scary-sounding terms like fibrocystic disease to describe what was really just simple breast pain or general lumpiness. But today, we use the A&D concept. A&D stands for aberrations of normal development and involution. It completely reframes the conversation. It recognizes that the breast is a heavily hormone-driven, highly dynamic organ. Most of these benign issues aren't actual diseases at all.
They're literally just minor, temporary aberrations of perfectly normal bodily functions. You can actually map these normal aberrations right across a woman's lifespan. From age 15 to 25, those breast lobules we talked about earlier are actively developing. A slight hiccup or aberration in this phase can lead to a solid, totally benign lump called a fibroadenoma. From roughly 15 all the way to 50, cyclical hormone changes happen every month, which can cause breast pain and temporary nodularity. And then, from age 35 to 55, the breast tissue gradually begins to undergo involution, which essentially means it's naturally shrinking back. An aberration during this phase is what often leads to the formation of those fluid-filled cysts.
Section 4. Managing breast pain, clinically known as mastalgia.
Up to 70% of women attending breast clinics are there because of pain, so it's absolutely vital to categorize it correctly. First, we have cyclical mastalgia, which is directly tied to the menstrual cycle. This type usually starts flaring up around day 14 and hits its peak severity right before menstruation, around day 28. Non-cyclical mastalgia, on the other hand, totally ignores the calendar. It might present as a very localized trigger spot of pain, or, and this is wild, it might actually be a musculoskeletal issue. For instance, a condition called Tsetse syndrome, which is just inflammation of the cartilage connecting your ribs to your sternum, can easily mimic true breast.
So how do doctors actually treat mastalgia? Well, it's a very logical step-up approach. Step 1 is simply reassurance and recommending a well-fitted support bra. Honestly, for the vast majority of people, just hearing a doctor say it isn't cancer provides immense, immediate relief. Step 2 involves dietary supplements, things like evening primrose oil or flaxseed, which are packed with helpful omega-3 fatty acids. If the pain is stubborn, Step 3 brings in topical anti-inflammatory creams you apply directly to the area. Finally, for really severe pain that's actively disrupting a person's daily life, doctors might step up to prescribe systemic anti-estrogen drugs like tamoxifen, just to aggressively dial down the tissue's hormone response.
Section 5. Let's talk about common benign breast lumps.
Finding a lump is terrifying, but let's rapidly summarize the most frequent harmless culprits. As we discussed with the Andy concept, a fibroadenoma is incredibly common in young women, stemming right from that early lobule development. A simple breast cyst is the usual suspect in middle age due to that involution process. Now, if a nursing mother suddenly finds a lump, it might just be a galactocele. That's essentially a blocked, milk-filled cyst that usually vanishes quickly with a simple needle aspiration. And then there's the phyllodes tumor. These are a bit rarer, known for growing quite large with a bumpy, bosselated surface, but the vast majority of these turn out to be completely benign too.
Now, in a real clinical setting, a giant fibroadenoma can seem incredibly intimidating. During puberty, these things can grow remarkably fast, sometimes swelling to over 5 centimeters in diameter. But you have to remember the underlying pathology we covered. This is literally just a hyperactive lobule. It is benign, it's perfectly safe to have it enucleated or shelled out surgically, usually through a tiny hidden incision right in the natural fold beneath the breast.
Of course, we know not everything is benign, and that is exactly why our imaging technology continues to advance at such lightning speed. Standard screening mammography is amazing. It uses X-rays to clearly reveal the physical, structural shape of an irregular mass. But then you have advanced tools like a PET scan. A PET scan doesn't just look at structure, it actually looks at metabolism. It takes advantage of something called the Warburg effect, which is this phenomenon where malignant cancer cells gorge themselves on high amounts of glucose. So on a PET scan, doctors can clearly see bright hot spots of intense glucose uptake, allowing them to instantly detect if a cancer has started spreading beyond the breast tissue. It's a real game changer.
We have covered a tremendous amount of ground today, from the changing hormonal tides that shape the breast's anatomy over decades, all the way to the incredibly precise, layered tools we use to investigate it. As you've seen, this tissue is highly responsive to the environment inside your body. So I want to leave you with a thought. Knowing just how sensitive this tissue is to hormonal fluctuations, how do you think your modifiable lifestyle choices, things like your diet or your physical activity, actively intersect with your non-modifiable genetics to shape your long-term health? It is a fascinating question, and absolutely one worth exploring as you continue your learning journey. Thanks so much for joining me on this explainer.